Hi, my name is Liliana Peleck, and I'm going to talk a little bit about dialysis. The first thing I want to talk is about the history of dialysis, and it was Dr. William Kolb was the first to construct a working dialyzer in 1943. He treated a 63-year-old woman with uremic coma who regained consciousness after 11 hours of hemodialysis treatment. In 1945, after the World War II ended, Koch donated 5 dialyzers that he had made to hospitals around the world. This led to the manufacture of the next generation of cold dialyzers, a stainless steel called Webcam dialysis machine. By the 1950s, William Kolb's invention of the dialyzer was used for acute renal failure, but it was not seen as a viable treatment for patients with the stage 5 of chronic kidney disease. So the fifth stage is the end stage of kidney disease. Dr. Niels Howell, in 1946, he created a modified version of the Dr. Kolb dialyzer. I will report this first in 1948, where he used such as arteriovenous shunt in rabbits. Then he treated around 1,500 patients in renal failure between 1946 and 1950. So I want to show a picture of the first dialyzer, and in that time was like a huge machine, a metal machine, and the filter in that time was made of the intestines of goats. So now in this time they made plastic and plastic fibers to filter the blood. How dialysis work? Dialysis patients all of them are familiar with what they have to do with the routine every day. The first thing is go to the clinic. Usually it's like 3 times a week that they need to go to the clinic, and the ones that they're outpatient. And we check the temperature, we check the blood pressure, we get the weight of the patients. In depends of that, we start the treatment. Depends of what the physician's orders. What is the dry weight? The dry weight is what they have to wait all the time, and because they don't urinate, they keep that urine and toxins, and those are the extra weight, so they need to lose in every treatment. With inpatient dialysis, when they're unconscious, they need to have it every day. But what I do is outpatient dialysis. After we get the weight, temperature, and blood pressure, it depends how we start the treatment. Some patients, they have catheters that is like a plastic hose that goes on the neck, is on the jugular, that it goes into the arterial. And the other ones is fistulas, or that is made from the vein. They put together the vein and artery, make one. And the other one is the graft, that is plastic, and they simulate that a U. And then they have also they use the buttonholes is when they have fistulas, and they have to be poked every treatment with the needles. So they have to with buttonholes, they poke in the same needle, so it's kind of a scratch a little bit the scab and place the needle on. I have a picture of a catheter and a fistula. So, this is a catheter that is placed here, and one is where the machine takes the blood out, and the other is where the machine takes the blood in. The red one is the arterial, and the venous is the blue one. The venous one is the one that take the blood out, and the arterial is the one that received the clean blood after the treatment. And then we have the fistula, that is what I was talking about the needles. So it's like it's pretty hard to see it. Okay, this is an arm, and we have to place 2 needles, and it's the same concept. The red one is the arterial, and the blue one is the nail. Is the venous. And as a dialysis technician, I would like to take this opportunity to explain how this dialysis machine works. The dialysis machine mixes and monitors the dialysate. The dialysate is the fluid that helps to remove the unwanted waste products like toxins from the blood. It also helps to get your electrolytes and minerals to their proper levels in your body. The machine also monitors the flow of your blood while it is outside of your body. You may hear an alarm go off from time to time. This is how the machine lets us know that something needs to be checked. There are plastic jugs that holds the liquids used to mix the dialysate. Those are the chambers. The machine mixes the dialysate, which is made up of an acidified solution and bicarbs and purified water. The solution contains electrolytes and minerals. You may hear it referred to as an acid. The other solution is the bicarbs, which is like baking soda. Both are mixed inside the machine with purified water. While you are dialyzing, the dialysate and your blood flow through the dialyzer, but they never touch. Fresh dialysate from the machine enters your dialyzer through your treatment. Toxins are filtered out of your blood in the dialysate. So the dialysate contains unwanted waste products and excess of electrolytes and leave the dialyzer and are washed down the drain. How does the blood get in and out of the body? Blood tubing carries your blood from your access to the dialyzer. The blood tubing is threaded through the blood pump. You'll see the blood pump turning in a circular motion. So it's when the blood comes out of your body, and then when the blood comes into your body. So it's a circle movement. The pumping action of the blood pump pushes your blood through the dialyzer and back into your body. Like I said, they have a speed pump, and usually when they have a catheter, the speed should be, top is 400, and for needles, meaning fistulas and graft or buttonholes, should be up to 450. It's faster, and the faster is the better. Clean your blood better. The syringe, we attach the syringe to the patient. Usually with catheter or fistula, usually they clot. So what I do is usually in the arterial, I put some like 5 cc's of saline, and in the venous I put heparin, that it's to prevent blood clots. So I put heparin and saline, and then the quantity of heparin, it depends what the physician prescribes. For every patient is different. Usually it depends on the weight of the patient also. The machine usually keeps safe. One problem that may occur is, air in the pumps, and we have to clear that like right away. It's crucial because the blood clot easily. If we don't fix the problem right away, it might happen that blood that is running in the machine, if it clots, won't get back to the patient. So that's about the machine. The importance of the alarms are, continually we have to monitor the pressures, the air, everything. After the treatment, the physician usually is the one who said how long they have to be in the machine cleaning the blood. Usually it's about 3 hours, but also depends of the height, the weight, the age, and how well they take care of themselves. The most that I see, the longest one is like 4.5 hours, and the short one can be 2.5 hours. So it all depends what the doctor said. After the dialysis treatment is done, it's the same thing. We have to check temperature, blood pressure, pulse, and those numbers indicate us how, if they can feel good, but if they have a low blood pressure, when they walk out of the clinic, they're gonna pass out. Or if they have a high pulse, means that they are super dry and they need, more saline. And usually when we return the blood back, is we have to give 400 cc's of no saline with blood. So to return, we're giving 400 of cc extra, and usually those 400 are taken off of the dry weight at the beginning. Patient treatment usually, like I said, is 3 times a week, and a lot of commitment. Patient needs to be careful on the diet and how much fluid they intake. So that depends of every patient, and they have to take care of themselves. The kidneys are not working, and this is one of the solutions. The other one will be renal transplant, but how often can they be the perfect candidates for a kidney transplant? So that's my job. How to work in dialysis, I guess. Thank you.